Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
WHO normal sperm count is 20 million per ml. Then aspermia is used to describe the absence of sperm. 25-year-old infertile male underwent semen analysis. The results show sperm count to be 15 million per ml and pH is 7.5 and volume is 2 milliliters. No agglutination is seen. Morphology is 60% of normal and 60% of motile sperms are seen. Most likely diagnosis is here there is morphology is 60% normal, 60% motile. So we will see. So the sperm count is 15 million per ml. So there should be more than 15 million per ml. This is fine. The pH should be more than 7.2. It is 7.5. Fine. Volume is should be more than 1.5 ml. It is 2 ml. This is also fine. No agglutination is seen. Okay. Then morphology, if you see, morphology is 60% of normal and 60% motile sperms. This is morphology, but now the morphology it should be more than 32% only. The here question is 60%, right? So it is normospermia. Motile sperms are more than 60%. Sorry, motile sperms or morphology is normal is 60%. Morphology there should be at least more than 22%. Sorry, here I got confused with morphology and motility. See, morphology of the sperms should be more than 4%, should be normal morphology, whereas motility should be more than 32%, that sperms should be motile. So obviously it is normospermia because 60% of sperms are normal and 60% of sperms are motile. Okay, next.
thank you and thank you for watching.